Post-intensive care syndrome family, PICS-F. 7 months ago, Doreen was in the ICU with pneumonia and sepsis. Her husband, Ricardo, thinks back to that time every day. He can't let go of the thoughts of Doreen on the ventilation. Every day he still feels the powerlessness and fear of that time. He was so happy when Doreen came home again. It was not an easy period. Doreen needed a lot of help, was forgetful and really tired. Now she's often irritable, gloomy and withdrawn. Doreen can't properly manage the housework or take care of the children, so Ricardo has to cook and do the washing after work. He's really worried about Doreen. He's afraid she'll get sick again. Every little cough frightens him terribly. If she leaves the room for a moment, he goes to see what she's doing. That really irritates Doreen. He really doesn't have to worry about her. But Ricardo does anyway. He often phones the GP with his concerns about Doreen. Things aren't going well at his work. He can't concentrate, makes mistakes and is extremely tired. He sleeps badly at night. He has nightmares about the ICU. When he lies awake, he listens to hear whether Doreen is still breathing. Things can't go on like this. Ricardo calls in sick and goes to the GP. For close family members, having a loved one admitted to the ICU is a stressful experience. The ICU is a scary environment with all its tubes and machines. They continually hear alarms and beeps. They feel powerless and frightened. They fear for the worst. This can lead to psychological complaints such as anxiety, depression, and post-traumatic stress. Together, these symptoms are called the Post-Intensive Care Syndrome family, or PICS-F. This includes complicated grief. Symptoms of anxiety are palpitations, irritability, dry mouth and sweating. A depression causes mainly lethargy and gloominess. Post-traumatic stress complaints are nightmares and flashbacks, memory avoidance, sensitivity and tension, irritability, and severe shock reactions. Restlessness, sleeping disorders, and feeling exhausted are very common. These complaints can occur at the same time. Ricardo is incredibly relieved that the GP understands why he's having these complaints. Together, they look at what's troubling Ricardo the most and what he can do himself. He gets some good tips. He's going to take up a sport, go for a walk before sleeping, and leave Doreen in peace. The GP encourages Ricardo to see a psychologist. At first, he thinks that's strange. Doreen was sick, not him. Still, he takes the advice. He gets therapy for the flashbacks and slowly learns to accept the new situation. After a while, he feels better. He can go back to work again and is relieved to let go of Doreen's illness. Their relationship is going well again. He's confident in the future with Doreen and the children.